Greetings from Spain. We are excited to present our work regarding the importance of voiding dysfunction as risk factor for urinary tract infection in men during the first ever ICS online meeting. The presenter has no affiliations to disclose regarding this presentation. Risk factors for urinary tract infection have been extensively studied in specific populations. But it has also been noted that adult male patients with UTI show high occurrences of predisposing factors. Urodynamic dysfunctions are a main risk factor for UTI in neurogenic lower urinary tract dysfunction, children and women. As we have already reported, abdominal straining during voiding in women can be considered a risk factor for recurrent UTI. However, studies on urodynamic risk factors for UTI in adult men are scarce. Our hypothesis is that urodynamic dysfunctions are also an important risk factor in men. The objective of the present study is to assess if there is any relationship between UTI and urodynamic findings in men. We developed a case control study including 32 men with lower urinary tract symptoms and culture-confirmed UTI, and 95 controls who were men with LUTS and negative urine culture, patients under 18 years, with neurogenic bladder, urinary catheterization, antibiotic treatment, anatomical abnormalities of the urinary tract, urolithiasis and genitourinary neoplasms were excluded. Detrusor contractility was calculated using the bladder contractility index. Urethral resistance using the bladder outlet obstruction index. And the abdominal activity during voiding with the formula shown in the screen. Men with urinary tract infections were older than the controls, and they also had a higher bladder outlet obstruction index and an increased voiding abdominal activity. No significant differences were found in the post-void residual, maximum flow rate, systometric bladder capacity or bladder contractility index. The multivariate analysis found that age was a dependent variable, and bladder outlet obstruction index and voiding abdominal activity independently influenced the development of UTI. The presence of bacteria in the urine does not always lead to infection. One of the protective mechanisms is the glycosaminoglycan layer, which can be disrupted by increasing intravesical pressure. Bladder outlet obstruction or increased abdominal strength can both rise it. However, in our study, other urodynamic dysfunctions like high post-void residual urine, detrusor overactivity or detrusor underactivity did not have influence on UTI presence. We hypothesize that these factors could depend on bladder outlet obstruction and abdominal straining. In conclusion, our study suggests a relationship in non-neurogenic adult males between UTI and both bladder outlet obstruction index and abdominal straining during voiding. Adult men with demonstrated UTI should be submitted to a urodynamic study in order to rule out these voiding dysfunctions. Thank you very much for your attention.